While doing some Medicare planning recently, I keep getting the question, how does Medicare cover long-term care? These people I'm working with were shocked to find out that Medicare does not cover long-term care. Hi, my name is Stephanie McKay and I'm with Safeguard Insurance. Today I'm going to be discussing what exactly does Medicare cover towards long-term care and how does all of this work. So the first thing I want to do is make a distinction between what is long-term care. Long-term care is not defined as extended care for medical purposes. Long-term care is often referred to as custodial care, and it is the completion of your activities of daily living. So that is things like toileting and incontinence, bathing, eating, dressing, and transferring. So transferring meaning being able to get to one place to another, being able to get out of your bed or out of a chair. That is custodial care. Medicare does not cover custodial care. Medicare covers skilled nursing care if you meet their criteria. So what is their criteria? What you need to meet is you have to be admitted into an inpatient hospital for 3 days. What I want to make a distinction on here is that you have to be an inpatient admittance to meet this criteria. If you are admitted on an observation basis, that does not meet the criteria. So you can be in the hospital for 3 days receiving the exact same care that you would be if you were admitted inpatient, but if it is not billed as inpatient admittance, then you are not meeting the criteria, and when you are moved to skilled nursing, you would be responsible for the cost of that care. So the first one is being admitted into an inpatient hospital stay for 3 consecutive days. The second criteria that needs to be met is that you need to be admitted into the skilled nursing facility within 30 days of your 3-day hospital admission. And the third criteria that you need to meet is that a doctor needs to say that it is medically necessary for you to be in that rehab facility, that skilled nursing facility. If you meet all 3 of that criteria, then Medicare will pay for you to be in skilled nursing. So what exactly does Medicare cover? Medicare will cover the first 20 days of you being in a skilled nursing facility at zero. You pay nothing for the first 20 days. Medicare pays the entire cost. After that, there is a per day copay from day 21 to day 100. That copay for 2023 is $200 per day. So if you make it to the end of your 100 days in a skilled nursing facility, your patient obligation is $16,000. You heard that right, $16,000. Now it is possible to add a Medicare supplement, also known as a Medigap, or to add a Medicare Advantage to help cover some of the holes in the skilled nursing benefit. That's why people elect to take private insurance, because it can be costly and there is holes in Medicare. And then after that, you pay 100% of the cost every day that you're in skilled nursing. Medicare does not cover skilled nursing benefits after 100 days. So I want to make the distinction of what exactly skilled nursing consists of. Skilled nursing is provided by medical professionals, medically trained, licensed, and they work under the supervision of a team of medical providers. These are registered doctors, licensed doctors. These are registered nurses. They have the credentials in the healthcare system. They are completing tasks such as evaluations. They can do catheter care and wound care and physical therapy and occupational therapy and dispense medications, and the doctors can write prescriptions. They can prescribe you new medications if that is medically necessary. Those are the type of services being provided in a skilled nursing setting. Now, custodial care differs in that it can be provided in a skilled nursing setting, but it does not have to be provided by medical professionals. Technically, custodial care does not have to be medically trained in any way, shape, or form. Custodial care refers to feeding and incontinence and toileting and bathing and dressing and transferring. That could be provided in an in-home setting. That could be provided in a nursing home setting. That could be provided in an adult daycare setting. So multiple settings can be used for custodial care. So statistically, what is the chances that you're going to need custodial care? Well, according to Health and Human Services, adults reaching age 65 are 7 in 10 end up needing some kind of custodial care in their lifetime. 70% of adults need custodial care in their lifetime. So statistically, you have very high odds of needing some form of custodial care in your life. So how exactly does that get paid for? We've established Medicare doesn't cover custodial care. It covers skilled nursing on a rehab basis where the intention is that you are going to get better and go home, that you will show progress and you will get better and go home. But they do not provide just routine, you're aging and you need help with your daily living. They don't pay for that. So what exactly are your options? Well, Medicaid is an option for some people. State provides Medicaid for those who qualify. They're usually looking at your income and your assets and different things like that. Typically, the state Medicaid is not going to come in and cover until you've spent down your assets or your retirement accounts to a certain amount. And then once you have kind of started to go through your own personal savings and investments and anything that you own, then they will come in and start paying for your care. The problem with that is that Medicaid, they're going to try to do any kind of custodial services as cost efficient as possible. You will be in a semi-private room that could be 2 to 4 people in that room. You do not have a choice of who you are spending that time with, who is in your room bunking with you. You, in a lot of states, do not have a choice of what facility they put you in. If you are in the Medicaid situation where you're trying to get into a nursing home, they will put you in the first nursing home that is available to a bed. They're not necessarily looking at whether it's close to your family or whether it makes sense. They're just looking at, we have a bed available, this is where this person's going. So you are limited in options in that way, and what exactly Medicaid is going to cover. The benefits are very limited for what exactly they're going to cover. And then another option is private long-term care. So a lot of people are thinking, well, long-term care is expensive, I can't afford it, or I'm not healthy enough for long-term care, or different things like that. There are cases where a traditional long-term care policy, especially older policies, could be expensive and that sort of thing. But now there are new options available and different things that you consider. So my thoughts are, this is something you need to plan for, something you need to be aware of. Long-term care is generally going to be something that just about every single person is going to need in their lifetime. The national average cost for assisted living is $4,500 per month, and the national average for a semi-private nursing home is $6,844. And if you want to elect to do a private room where you have no roommates whatsoever, it's $7,698 per month. That's not something that most people could just afford to pay out on a monthly basis for an extended period of time. This is something you need to plan for and be prepared for. And that is where Safeguard steps in. We can answer your questions, we can guide you, we can help set up a plan for you, a cost-effective plan, something that is in your budget to help alleviate some of these costs. You don't have to do this alone. You don't have to spend your life worrying or concerned about how am I going to pay for this if it happens. Set up your plan now while you're healthy enough, while you're able, and you won't have to worry about what's going to happen to you in the future. You won't have to worry about, am I going to be a burden on my children or my grandchildren? Is somebody going to have to care for me? A lot of times, people can end up in a position where they don't have someone to care for them, or the people that are caring for them don't have the financial means to support them. And in a case where people are they're physically having to care for a loved one, their own health goes down and they come out of the situation in worse shape. If you do not want to feel like you're a burden on your family in the future, make a plan. You are one phone call away from having a plan in place to take care of all of your concerns and all your needs. So just give us a call. We'll help you come up with something that makes sense for you, and you won't have anything to worry about going forward. So stay tuned. The next video we're going to make is going to be about different type of long-term care strategies and options. Thanks.